So in which diabetes does DKA occur? In type 1 diabetes. In DKA, the pH is less than 7.3, which is acidotic, and the bicarb is less than 15. So this is a metabolic acidosis. In a patient with severe acidosis, with pH less than even 7.1, what are we going to do to them? We're going to transfer them to the ICU. What are the ketones that are causing this entire DKA episode? Beta-hydroxybutyrate. How high does the blood glucose have to be for this to be DKA as well? 11 millimoles per liter or higher. What are the 3 severe complications of DKA? Well, patients can get cerebral edema because if we correct the blood glucose too quickly, the water can herniate and cause cerebral edema. Where the glucose goes, the water is also being transported. There's hypokalemia because even though the serum, even though the plasma potassium levels might be normal, the intracellular potassium stores get depleted. Here's insulin and K+. When we don't have enough insulin, the intracellular potassium, because insulin and potassium work together, the intracellular capacity of potassium is low, even though the potassium might be high in the serum. The other complication includes aspiration pneumonia. What might be the clinical findings of DKA? The patient might be in shock. They might have deep breathing or a fruity breath odor, which is due to the ketones. They might have abdominal pain and tachypnea. The pathophysiology here is the glucose in the blood is too high. It can be due to infection, ischemia, consuming too much glucose, or not taking your insulin meds. And there's no insulin in the body, so the catecholamines launch an epic catecholamine cascade and response in which the epinephrine is increased, so is the cortisol. What these do is they do 2 things simultaneously. They raise the blood glucose, causing osmotic diuresis, which causes these patients to become dehydrated because if the blood glucose is really high, they're going to start to lose this water. That's going to cause polyuria and polyphagia. They also have fatty acid breakdown, increasing the ketones. But the dehydration is what also presents with vomiting, dehydration, and worsening metabolic acidosis. The mnemonic for IMDKA is I for insulin deficient, I for infection, I for ischemia, D for delirium, D for dehydration and adding dextrose. K is for Kussmaul's breathing, K is for ketones, and A, we know, is for acidosis. So how do we treat this? We want to give them a fluid bolus. The way to treat DKA is to give a fluid bolus. Fluid bolus. It's typically 10 mils per kilogram of a bolus dose. And the point of that is not for euvolemia, because euvolemia in a DKA patient as a management strategy is bad. It can cause issues. It can lead to cerebral edema. It can lead to other complications. The cardiac arrhythmias can be due to, once again, potassium repletion or potassium depletion. Now, the point of this 10 ml, we want to give fluids. Essentially, giving fluids is the mainstay of treatment. We want to give fluids because they're dehydrated. We want to give, but not for euvolemia. The reason why we're giving fluids is to restore end organ perfusion, preventing severe end organ damage. So the first one was fluids. Second one is insulin. We want to give insulin at a dose of 0.1 units per kilogram per hour, okay? 0.1 units of insulin per kilogram per hour. The next thing is we will give glucose. Why? Because as you've given the insulin initially, you have to give glucose to renormalize the blood glucose, because the insulin is going to cause what? Hypoglycemia, okay? Then we give potassium. If it's less than 3.3, we start with IV potassium. 3.5 to 3.5 to 5 is normal potassium. However, if it's more than 5.3, we hold the potassium and recheck in 15-20 minutes. Then the other things we replete are calcium, magnesium, and phosphate to prevent arrhythmias. The only thing that we have yet to mention is that a bolus dose is typically given at 10 mils per kilogram, but you can do 20 mils per kilogram too. Unless the patient is in shock, then obviously they will need more fluid bolus dose. The mnemonic here is FIG-CAMP. F is for fluids, I is for insulin, G is for glucose, K is for potassium, and CAMP is for calcium, magnesium, and phosphate. These mnemonics are from the internet. Thank you for listening.